study coming in with Zepbound weight loss, Wegovy weight loss, or semaglutide and Tirzepatide weight loss with breast cancer. Hi friends, if we don't know each other, I'm Elizabeth, Countess of Shopping. I've been actively looking about breast cancer related to GLP-1 medications. If we don't know each other, I'm Elizabeth, Countess of Shopping. I've been on GLP-1 medication, losing a whopping over 95 pounds the last 21, almost 22 months of being on Mounjaro and then switched to Zepbound and Tirzepatide compound and back to Zepbound because of the shortages going on. And on today's episode, I am so excited to talk about this breast cancer episode. It's got some new scientific data. I've previously done an episode, and you can see down, make sure you click that like and subscribe button on my playlist about cancer in general. And in that video, it talked about how breast cancer with a recent study, it did not see a change in cancer. And these are very full disclosure, two full disclosures at the beginning. One, these are very preliminary studies. We still need a lot more data and information, but I do think from an interest standpoint, these are interesting to see where GLP-1 medications are going. Two, I am not healthcare or medical. I always punch you back to your healthcare provider or your medical provider. I love doing videos because I've lost a ton of weight and I love sharing what my experience, strength, and hope, but I will always punt you back to your healthcare provider for your medical needs, medical questions. Anything medical is not me. This is more of an encouragement video and sharing some of the data associated with it for you to then have that conversation with your healthcare provider. So now that we're clear on that, let's dive in. So there's a new article that came out, my source, and I will always cite my sources. They're down in the description link below. Click that more button. You may need to click it twice on YouTube. YouTube has changed some of the description, like where you can find the description information, but I do cite my medical sources because I want to be factually accurate. That is very important to me here. In a world of where things are not factually accurate, I require and demand that of myself. So this was written by Alexander Otto, PAMMS, and the title is called Popular Weight Loss Drugs Now for Patients with Cancer. But more specifically, this article goes into talking about breast cancer. And so if you're looking for other cancers, again, you can see that in my playlist video down below. So it's saying in here that there's limited data associated with GLP-1 agonists for weight loss and cancer, but some oncologists have carefully been integrating anti-obesity agents into care and studying their effects with patient population, which makes sense, right? Like, so many people are on GLP-1 medications. And the reason is research suggests that obesity can reduce the effectiveness of cancer therapies, especially patients with breast cancer, and can increase treatment-related side effects. Now, this is one of the things I hadn't thought about someone going through cancer treatment being on a GLP-1 medication. But the article talks about this, about how, because of our side effects, we know the main side effects for GLP-1 medications for Zepbound, Wegovy, Tirzepatide, semaglutide is gastrointestinal, diarrhea, constipation, nausea, vomiting. Those are very, very normal and standard. If, by the way, you're taking a GLP-1 medication and you're having severe side effects, immediately talk to your healthcare provider. But it would make sense if someone's having cancer treatment, you don't want them having diarrhea or nausea because they're probably already feeling pretty nauseous. And again, this is me reading from the article of how it's talking about side effects related to cancer treatment. I have not had cancer treatment, so I don't know firsthand on my own experience, strength, and hope. But it was going through here and it said the idea of managing patients' weight will improve cancer outcomes, explained Lahoyas. It's Dr. Pezita, PhD, MD and PhD, a breast care specialist and professor of medicine at Yale School of Medicine in New Haven, Connecticut. Dr. Pezita and his oncology peers at Yale don't yet use GLP-1 agonists. Dr. Iyengar and his colleagues have been doing they've been doing so with patients with breast cancer to manage their weight. Dr. Iyengar estimates that a few hundred, almost 40% of his patients are on anti-obesity medications. And for patients who's already tried to reduce their weight and who is in the obese range, that's where I think the use of these medications can be considered, the breast cancer oncologist said. And so the article continues to go on talking about that in practice, these drugs do increase nausea and vomiting from chemotherapy. So Dr. Iyengar typically has patients use them afterwards, excuse me, during their cancer maintenance periods. Oncologists don't prescribe the drugs themselves. Instead, the oncologists, the cancer doctors, are referring them to endocrinologists or weight management centers who then write the prescriptions. If you are needing somewhere to help write your prescription, Join Fridays is who I've worked with since 2023. They're reputable. They prescribe both brand names or compounds. Use the discount code QUEEN. That's linked also in the description link below. But so taking these weekly drugs, the patients can administer themselves. And so then they go through talking about the maintenance periods with hormone therapy for breast cancer. This is where it gets fascinating to me. Literally, my jaw was on the floor. Get ready. Brace yourself, clutch your pearls, or clutch your peacock necklace if you have one. And it goes through and it talks about hormone therapy and use these agents for patients with prostate and endometrial cancers, and has found drugs can help counter steroid weight gains for people. That is interesting to me, but it keeps, there's more layers of this. Okay, so it goes through, and research largely comes down to a few small retrospective studies of patients with breast cancer receiving aromatase inhibitors. Although no safety issues have emerged from these initial reports suggest that drugs can lead to significantly less weight loss in patients with cancer compared to the general population. Dr. Iyengar led one of the studies, and it was actually presented at the 2024 American Society for Clinical Oncology at the annual meeting. He assessed this is fascinating, 75 women with breast cancers who received GLP-1 agonists. Almost 80% of patients had diabetes, and 60% received hormone therapy. Patients' median BMI was 34 kilograms, and the range should be in kilograms, 23 to 50 kilograms. I wish I had had a calculator to figure out kilograms to pounds. US pounds, I'm like, oh, what are the US pounds? Okay, so from the baseline, the patient lost 6.2 kilograms, on average about 5% of their total body weight, 12 months after initiating GLP-1 therapy. So in my brain, I'm like, okay, they started off at 200 pounds. Let's do some conversions here. And they lost 5% of their body weight. Pencils down, Rose Nylon. That's only a loss of 10 pounds after 12 months of GLP-1, initiating GLP-1 therapy. In contrast, phase 3 trials show much higher mean weight loss, about 2 times that in patients without cancer. That's not great results. To lose basically 10 pounds on average after 12 months of their total body weight. And I'm saying on 10 pounds, it said 5% their total average body weight. But I'm saying if it was say a 200-pound woman is what I'm saying. That's how I got the 10 pounds. Another recent study also reported modest weight loss results with patients with breast cancer undergoing endocrine therapy. The researchers reported that at 12 months, Wegovy led to a 4.34% reduction in BMI, compared to a 14% change reported in the general population. So 4.34%, a little bit more than 4%, to 14%. That's not really working. The GLP-1 isn't GLPing. It has in there the BMI increase overall, though some patients did experience a decrease compared to the 15% reduction in, Zepbound. So that was Wegovy. But get this, for Zepbound, the Zepbound ones, however, associated with a 2.3% BMI increase overall, although some patients did experience a decrease compared to the 15% reduction. So people actually had a 2.3% BMI increase, not a 15% decrease that most people have. So these findings indicate a substantially reduced weight efficacy, meaning like how well does the treatment work? Is it doing its job basically in breast cancer patients on endocrine therapy compared to the general population? Again, this is a very preliminary trial. So knowing that in terms of science data, there's still a lot of that's a small percentage of, that's a very small study. It still needs further testing with this, but I do think that this data was worth bringing and talking about. It's interesting to me. It's unclear why the drug appears to not work as well in patients with cancer, right? So it's really not working. Like, to gain weight on Zepbound by 2%, and then to only decrease 4% on Wegovy. Typically speaking, by the way, Zepbound, because it's a Tirzepatide, actually has slightly higher data usually than Wegovy, because Wegovy is a GLP-1, Zepbound, it's semaglutide. Zepbound, Tirzepatide, is a GLP-1 and a GIP-1. And so it actually has a second hormone on there. And again, I'm not medical. That's my non-medical explanation of it. I'm sure the wiser people who actually have their medical degrees and things like that would explain it far better. But that's my limited basic understanding of being on GLP-1 medication the last 21 months. So patients with cancer may need a higher dose of GLP-1 agonists to achieve weight loss, similar to the general population, was one of the theories. But also, it's unclear as to why the drugs aren't working as well. It's possible that the hormone therapy and metabolic changes interfere with the effectiveness, given that some cancer therapies lead to weight gain, right? And so then, oh, that makes sense. Why was there a 2.31 or over 2% increase on Zepbound? Because those patients may be having the weight gain associated with steroid and hormone therapies, for instance, often increase appetite, and some treatments can slow patients' metabolism or lead to fatigue, which make it harder to exercise on. Gallagher said in her own experience, she hasn't found the drugs to be less effective in patients with cancer, especially newer agents like Wegovy and Zepbound. And then they talk about the black box warning for the thyroid C cell tumors. Always talk to your doctor about that. If you have that hereditary, if someone else in your family, it's genetic, have the thyroid C cell tumors, talk to your doctor about that, or a healthcare provider. Shu, it's talking about hasn't seen any secondary tumors, thyroid or otherwise, in her patients already with cancer. And it goes through being cautious about people who have GLP-1 agonists in patients who've had bariatric surgery, because these agents can compound the slower gastric emptying and intestinal transit from surgery, potentially leading to gastrointestinal obstructions, which we've talked in my free group quite a bit about this recently. It's fascinating to me, people who I haven't had bariatric surgery. I was going to a few years back. I was meeting with a doctor, and I did not feel right in my bones. I did not feel comfortable doing it. I was like, I'm just gonna wait. And more pain developed from from morbid obesity, and I really was debating about I needed to do something, and that's when GLP-1 medication, thank God, came out. But it's interesting to me with bariatric surgery, there's a lot of people in my free encouragement group, which is linked down below. It's an amazing, fabulous encouragement group. You do not have to do GLP-1s by yourself. There is a whole supportive community, but if you're not fun, please don't join my group. And if you're not nice, also please don't join my group. It's only for fun, nice people. And that's linked in the description link below. But people who've had bariatric surgery, it's fascinating to me, their experience. And what I'm seeing, I have no scientific data with this, but people with bariatric surgery being on lower doses of the medication. I'm tapped out. I'm actually on Zepbound 15 milligrams. There's nowhere else for me to go. That's the highest dose. They don't talk about this in this article at all, but it does talk about that gastrointestinal obstructions. So if you've had bariatric surgery, that's another thing to review with your healthcare provider before taking the medications or during, right? And that's where I think checking in, for me personally, my experience, strength, and hope of when I was morbidly obese, there was a massive disassociation with my body, checking in with my body, how my body felt, and clearly an unhealthy relationship with food. One doesn't get that obese, in my opinion, without having some sort of distorted, unhealthy relationship with food. Obviously, I have a disease, but part of that too accumulated for me the effect of having an unhealthy relationship with food, which I subsequently have been healing. I've talked about that in other videos. I won't go into that on this video. But the point is, to test effectiveness of GLP-1 agonists in oncology, but also nail down their safety in cancer. I don't think that the doctor goes through and talks about just a lot of the unknowns that we don't understand. So we're very preliminary, but I like talking about these because these are sparking the conversations for you. You've got somebody in your family who has cancer, or if you've previously had cancer. We talked with my recent I was going to say my mammography. That's probably not the right word. My mammogram scare that I had, which get your mammogram. I'm telling you with love, you guys reminded me for 6 months to get my mammogram. And I wish I had done it sooner, but thank you for reminding me. So I'm going to remind you ladies. And if you're a gentleman watching, remind your partner. and you love the women in your life, go get your mammograms. That this is fascinating to share this video with people is what I was trying to get at. The biggest challenge is companies will have to show a sizable benefit to using these drugs with patients with cancer to get the FDA approval. And to move the needle on cancer-specific outcome, these anti-obesity drugs will need to demonstrate significant, durable weight loss in patients with cancer. If these drugs can do that, I think that will be one of the biggest advances in medicine, says Dr. Iyengar. And Dr. Iyengar, by the way, so I was an advisor and researcher who has ties to the company who are developing GLP-1, like Pfizer. There's a bunch of companies listed here. And he's also a consultant with a couple of other places. So I always do like to share where there could be some conflicts of interest in there. And so there's obviously that's how he's getting paid is through some of those companies. But that to me is fascinating. This is fascinating. And I hadn't thought about, oh, well, that makes sense with people who are getting cancer treatments. They said the one doctor had said that her population was around 40%. But it wasn't as working as well. It's substantially slower. But my question to that then is, if there's weight gain during cancer treatments, that's helping. Even a 4% decrease. I said about the 10-pound part, it was 5%. On the example I gave of a 200-pound woman having breast cancer treatment, she lost 5%, which would be 10 pounds in a 1 calendar year. That's still, though, better than gaining the weight, too, on that counterpoint to that. And I also don't want, if someone's watching this, my heart now, I feel, please forgive me. If that, I wasn't trying to be insensitive. As somebody who has been on GLP-1 medication and has lost 10 pounds, I wasn't trying to diminish that at all. So please forgive me if that came across that way in any regard. I'm checking myself as I'm not going to re-record this video, so I'm not going to edit that part out. But if that was insensitive or hurt someone's feelings, never my intention. Always my intention is to be inclusive and encouraging and loving, and if that didn't come out that way, I want to make sure it does. I'm totally taking a right turn over here. A couple of things. I always like to share, you guys know I test stuff all the time. It's one of my favorite things to do. Territory Foods, my meal delivery system, a new batch just came. I made it for the Duke's lunch today, and it's going to be my lunch here after I'm done filming this video. I'm so excited. The meal I'm having, it's lemon pesto chicken. I didn't get it with sides. The meal plan that I have in their meal delivery system, you can use the discount code QUEEN25, all in capital letters. I'll link it in the description link below. If you want fresh, not frozen, but fresh like vegetables and proteins, they have in terms of calories the 300-ish to high 300 calorie range with around 23 to 28 grams of protein. So they're higher protein. And for me, I want the vegetables because of the fiber, but you could not get vegetables if you didn't want to. You can pick, they have all these different things you can pick. But this week I picked a lemon pesto chicken, and I don't like chicken to make it, but I like other people to make it. It looked beautiful. I'm going to put it in a wrap. I'm so excited. It's going to be my lunch, and then I'm going to have it with a little salad or some sort of vegetable. I got to get some greens in. We got to keep that Zepbound constipation at bay. So that was one of my exciting things that I am loving, in addition to my proffies, my protein coffees. Sports bras. Can we talk brasiers for a moment? These are on my Amazon shopping haul, like my clothing haul. I have several different ones. Like if you're just starting GLP-1 medication, I've got that link down below on an Amazon shopping list, my beauty list. And then this is the clothing one. These sports bras are fire. They were on sale last week. I don't think they're on sale this week, but you do want to stay tuned. 8 a.m. No. Tuesday, October 8th, 3 a.m. Eastern Standard Time, midnight West Coast time on Tuesday, October 8th, 2024. I will be releasing all of the Prime Day deals. I'm hoping this will be on that list because I'm going to buy a ton more. I bought a bunch last week, but I wear these so much for working out. And if you are working out with the GLP-1 medication, gentlemen, I should have said earmuffs. These are the best. They have other ones like for yoga and stuff, but they're high impact. They have cups on there. They're anti-leg wicking so they don't get all sweaty. I sweat, honey, when I'm working out, but I wear these to Pilates. I wear these on my 6-mile walks. I am obsessed. And the biggest part is when you wash them, the daggone cups don't pop out. The cups don't pop out. Woo! It's a 40-year-old's dream. Oh man, I need to get a life. Literally, I was singing his praises. I was like, yes, the cups did not pop out. I'm also going to be having, as I do every day, but my Gem Bites, my vitamins. I'll link those down below too. So those are some of the exciting things going on with GLP-1 medication. Our question of the day for accountability, what are you doing today to move you closer to your goals? Tell me down below. And our emoji of the day is going to be a peacock. Now, whenever I ask for the peacock emoji, for our emoji of the day, people sometimes put chickens and it cracks me up. So I love it. You put whatever bird you want, but I do love me a good peacock. We have a peacock farm near my house. Fun fact. So at nighttime, you can hear them. They're like, I'm like, oh my God, are they okay? I don't know if maybe they're mating. Maybe that's their mating call. I don't know. So the emoji of the day, I do that to help to get to know you better because I truly do care. The pattern recognition of seeing your name over and over. Also, I will pray over you. If you don't believe in prayer, I'll uplift you in positive thought because all are welcome here at the table. And I like to be an inclusive group. So if that makes you uncomfortable, don't worry. Then I'll uplift you in positive thoughts. I'm pumped for this week's episodes. If you've not smashed that like button and that subscribe button and shared this video with your bestie, go ahead and do so. I'll wait. I'll do the hustle. Dun, 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 dun. I hope I'm going to go eat my territory food today. It's the meal delivery system. It is so good. Okay, and I'll link that down below. Be kind to yourself. Be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. Love y'all. See you tomorrow.